Sleep has long been acknowledged as essential for overall health, but emerging research, highlighted most recently by the American Heart Association, AHA, shows that the relationship between sleep and cardiometabolic health is far more complex, fragile, and alarming than the public realizes. It is not enough to simply aim for 7 to 9 hours of sleep per night, as the Centers for Disease Control and Prevention (CDC) recommends. The quality, timing, consistency, and satisfaction of sleep all play critical roles in maintaining heart and metabolic function. Yet, many people continue to misunderstand or underestimate how delicate this balance is, potentially putting themselves at serious risk. When we focus only on sleep quantity, we overlook significant dangers. A person may technically clock 8 hours in bed, yet experience fragmented, poor-quality sleep that still leaves them vulnerable to heart disease, stroke, diabetes, and obesity. Studies now show that disrupted sleep continuity, frequent waking throughout the night, can signal underlying health problems like indigestion, bladder dysfunction, or sleep apnea, each of which exerts further pressure on the cardiovascular system. This cycle can lead to systemic inflammation, high blood pressure, and insulin resistance without any obvious daytime symptoms, making it a silent but lethal threat. The body's circadian rhythm, its internal clock, also plays a pivotal role in cardiovascular health. When this rhythm is disturbed by late-night screen use, exposure to artificial light, irregular sleep patterns, or shift work, the risks mount dramatically. Circadian disruption has been shown to not only worsen sleep quality, but also to directly impair cardiac function, increase blood sugar levels, and promote fat accumulation, all of which heighten the chance of a catastrophic cardiac event. This means that even those who believe they are getting enough sleep may be setting themselves up for future heart failure or metabolic collapse without realizing it. Moreover, the broader demographic and social factors affecting sleep health paint an even darker picture. The AHA warns that marginalized communities, those facing racial discrimination, financial instability, and environmental hazards like noise or pollution, are at significantly higher risk of poor sleep and, consequently, worse heart and metabolic health outcomes. These are not minor inconveniences, but systemic, compounding dangers that can slash years off life expectancy and vastly increase the burden of chronic illness. The intersection of low socioeconomic status and poor sleep health is a ticking time bomb for public health, and yet it remains grossly underaddressed in both healthcare systems and policymaking. Another unsettling reality is that relying on pharmaceutical aids to address sleep issues could backfire. While sleep medications can temporarily help with falling asleep, they often fail to improve the quality or natural continuity of sleep, and they may bring about dependency, cognitive dulling, and even further cardiovascular risks. The AHA emphasizes behavioral interventions, like maintaining consistent sleep and wake times, minimizing light exposure at night, and creating optimal sleep environments, as safer, more effective strategies. Still, achieving these goals remains out of reach for many, particularly those whose living conditions, work schedules, or psychological stressors present daily obstacles. Notably, persistent poor sleep does not only affect future health risks, it can erode current mental health rapidly. Sleep deprivation is strongly linked to depression, anxiety, impaired cognitive function, and emotional dysregulation. The combination of worsening physical and mental health creates a dangerous downward spiral, increasing the likelihood of poor lifestyle choices such as unhealthy eating, smoking, or sedentary behavior, further fueling the risks to cardiometabolic health. The AHA's call for a multidimensional approach to studying sleep is not merely an academic suggestion. It is a desperate plea to reconsider how seriously we take our nightly rest. Sleep duration, timing, regularity, and subjective restfulness are not abstract metrics. They are indicators of how well our bodies are able to heal, regulate, and protect themselves from an increasingly toxic environment. Ignoring these indicators, focusing only on hours slept, is like checking only the oil level in a car while ignoring a cracked engine block. The threat of ignoring proper sleep hygiene cannot be overstated. We are already seeing the consequences in the form of rising rates of obesity, type 2 diabetes, heart attacks, and strokes among younger populations. If the multidimensional aspects of sleep health continue to be neglected, this crisis will only deepen, overwhelming healthcare systems and devastating countless lives in the process. In the end, the stakes are brutally clear. Overlooking sleep health does not merely lead to tired mornings or groggy afternoons. It could be a matter of life and death. Heart disease remains the leading cause of death globally, and mounting evidence implicates poor sleep not just as a contributing factor, but as a potential accelerant. For those hoping to reclaim their health, small changes are crucial, but must be sustained and comprehensive. Prioritizing a consistent sleep schedule, minimizing nighttime exposure to blue light, creating a dark and quiet bedroom environment, and aligning sleep patterns with natural circadian rhythms are critical steps. However, true progress will require a broader societal shift that addresses inequality, environmental disruption, and education about the critical role of sleep. The cold truth is this: ignoring the complexity of sleep health is a silent gamble with devastating odds. And unless we take deliberate, sustained action, we may soon find that no amount of medication, diet change, or exercise will be enough to reverse the damage done by years of neglecting the most basic, powerful healing tool we have: sleep.